It's estimated that more than two-thirds of jail detainees have a substance abuse disorder, and almost one out of every five has a serious mental illness. The Granville-Vance Department of Public Health is leading a 5-county initiative to respond to these numbers. It's the only multi-county initiative in our state. Bob, let's start with you. Thinking through the numbers of people in our jails with substance abuse or mental health issues, are we just getting better at identifying people, or is the issue that the problem is actually growing?
I think we are getting better at identifying those individuals with mental health and substance use in jails, but it is a major problem and has been a major problem for a long time. And those statistics that you mentioned reflect that. For individuals with mental illness who go to jail, about 3/4 have a co-occurring substance use disorder that complicates their treatment. About a third of people, of those with a substance use disorder, will have a co-occurring mental illness that, again, complicates their treatment. So it is a major issue that many counties around the state, many counties around the country are grappling with.
So, Robin, let's go to you. What are the options for services, for treatment for this large number of people in jails with substance use and mental health issues?
Well, for the last few years, we've been worried about emergency departments and jails becoming the safety net for folks with mental illness and not a place to get treatment. And so seeing an opportunity to connect folks who have been in jails to treatment is essential. So, and counties have different kinds of services available to them. Of course, inpatient hospitalization is the most acute level of care that someone can be given, but we're looking at the opportunity for folks who have been in jail and who have mental illness to connect with local community services. And sometimes that happens in the jails. You know, in Alamance County, we know that there are GED courses that are taking place in our jail, and AA sessions are happening in jails. But we're looking to see if there are other kinds of ways to get folks connected on reentry back into the community.
So, Dana, when you think about this from your perspective, what are the opportunities that we may be missing?
So I think there are a lot of opportunities that that providing services or linking people to care and diverting them from the criminal justice system, there are a lot of opportunities for us to jump on. I think that over time, we've slowly seen a decrease in the number of services that are available to people with mental illness or co-occurring disorders. And we have, which has led the jails to become sort of the de facto mental health providers. And so what that means is that we really need to both think critically about how to link people to care so that we can divert them from the criminal justice system and divert them into the care that they need in the community setting. And so that really requires for us to engage in partnerships that really haven't existed in the past. And so it really creates an opportunity for us to give more of a holistic perspective on both identifying those who need treatment and then linking them to the care so that we don't put them within the criminal justice system.
So, Bob, I want to come back to you and stay on this topic of opportunities for a second, because we've heard both Robin and Dana suggest jails might be becoming the de facto place for care. Respond to that for me.
Well, unfortunately, jails are a de facto place. If people end up not getting the care they need in the community, then they often end up getting in trouble with the criminal justice system and ending up in jail. Emergency rooms are also a de facto place where people who end up not getting the care they need often show up. Much is being done to be able to divert those individuals from the criminal justice system to treatment in the community when that can be done at little risk to public safety. And the vast majority of people who end up in jail with a mental illness are there typically on fairly minor crimes that are more of a nuisance sort of crime than a threat to public safety.